you're going to have different ways that the insurance company can limit access to prescriptions and control cost. So you got prior authorizations. We've already talked about that. Very similar on the healthcare side.
Right.
Doctor's got to say, yep, Betty Joe needs this prescription because of X, Y, and Z. And that's got to get submitted to the insurance company. They got to approve it, and then they go get that filled, right? Not really a big deal.
Right.
What's interesting is we barely ever see any issue at all with those. Correct me if
No.
you say, yeah, hardly ever. Those are typically done pretty well for some reason. Contrary, on the health side, that's where we see more issues from that billing department for whatever reason. So prior authorizations, you've got, as well as that, quantity limits. This is something we see. What that's designed to do is just limit the amount of the quantity that you can get of that prescription in a given time frame. So think about like a narcotic, somebody taking a Norco. There's been a crackdown on those type of prescriptions for past number of years, right? So maybe that insurance company limits it to a 30-day quantity, and they'll only get you 2 a day, right? Now that might vary though from company to company, right? So you might be on a atorvastatin and somebody's got a quantity limit on atorvastatin for whatever reason, or lisinopril. And you're like, what? Why? This is like common med, but one company may limit to 30-day supply, where another might allow you 90 days. And that may just be more of a convenience for you, right? Because now you can get a 90-day supply for some of these maintenance meds. Then you've got the next step, the next way they limit it, which is step therapy. And so the insurance company may have your Linzess covered on their formulary, but they may require you to try a less expensive alternative in that clinical category, or they will actually cover this Linzess, for example, right? And that's a way they're going to control cost. So maybe you've already tried an alternative. Doctors got documented proof. They tried this med, they tried that one, didn't work.
Right.
So that documentation needs to be insurance company. They see what they need to see. Now they're like, okay, we'll pay for this drug. So that's kind of the process that has to be gone through in that situation. So that varies though from company to company, all these items I just mentioned. So we want to look deeper than just, is my prescription covered?
Right.
Right. And is my pharmacy a preferred pharmacy? There's a little bit more depth. And we can get even more granular than that when it comes to prescriptions being covered or not covered. But yeah, I think that's a good high level view.
Yep.